I would recommend that we search for the best material for that patient, for that specific case. And we have many. We have zirconia, we have lithium disilicate, we have lucite. So by combining and by knowing the benefits and the drawbacks of all of them, we can, for the concrete patient, find the best solution. So, hello everyone. My name is Professor Danimir Jevremović. I'm coming from Belgrade, Serbia. I work at University in Pančevo, which is in Vojvodina's part of Serbia, and there I'm a Vice Dean for International Cooperation. Well, this was specially dedicated lecture to zirconia material in general, right? And to the use of zirconia with some specific everyday cases like colored or discolored or metallic abutments. Well, you know, zirconia used to be quite material similar to metal ceramic. It was totally not translucent. We were considering it as a white steel somehow. But, you know, with all these developments that we have now, despite the fact that we can still use it as the opaque one, now we can do much more with translucent zirconias. And this opens a totally new field of indications, totally new field of work, totally new ideology that we can actually have in everyday practice. This is why I think with the development of 3, 4, 5 eye materials, of multi kind of discs, then we can really do specific mixtures and also combine it with like lithium disilicate or some other materials that we can match together so that to get the result that we actually want. You know, the good thing is that now we can actually do monolithic zirconia crowns, which are really nice aesthetic-wise. I cannot say that they are as good as cutback, right? They are a little bit inferior, but the strength is much higher. So to be very honest, this monolithic zirconia ideology has a true advantage that you can really nicely test this with temporary restorations. And then you're going to get one-to-one result. So if you like the temporaries, you get the same zirconia. There are no surprises. This is really totally nice full digital protocol. Okay, if you would like to get utmost aesthetics, then you could use a little bit of cutback. But still, in my practice, we can say perhaps 80% now is full monolithic. If patient would like to have some specific demands in anterior area or so, we can do cutback. But also, just to mention that the price for the patient is different. Right? So the expectations, you need to hear from the patient what he would like to get, and then this is what he is getting. And fortunately or unfortunately, there is an increased demand for bleach cases, in which also full monolithic is somehow sometimes even better, because the more you are using transparent materials, you are starting to lose value. Sometimes this patient who would like to bleach don't like it so much. I'm not a bleach type of the guy in my head, but others are. So we are just giving them what they want. Yes, well, you see, this is an interesting thing because previously we did not have such as problems. We had the fact that it was too opaque. Now it's coming to the fact that it can be even too translucent, especially if it is quite thin. This is the problem. And in these cases, you can try to mask the background, right? This would be the first option. For example, if you have a metal die, a metal post, right, then you can use the opaquer, which is a composite opaquer that you apply to the surface of the metal, and then you're getting something better, right? The second option as well, if you have any thin material, is to cover from the inside with the infiltration opaquer so that you get a little bit more of opacity. You know, we are always talking about translucency, we want translucent materials, true. But in many cases, we would actually like to cover the background and not see it. And then we have these opaque things. In the worst case that nothing of this would help, then actually we should go back to the totally opaque zirconia. But then also the thickness of the restoration should be a little bit decreased. Otherwise, you're going to get anesthetic result. Well, the take-home message is that we need to be versatile, in my point of view. So there is no one material, there is no one solution. The same way that you cannot find one card for everything. You do have a card for Budapest, like overcrowded city. Then you have a different kind of card if you like to go to Balaton or you would like to go to mountains, you know. So it's totally different. In the same way, I would recommend that we search for the best material for that patient, for that specific case. And we have many. We have zirconia, we have lithium disilicate, we have lucite. So by combining and by knowing the benefits and the drawbacks of all of them, we can, for the concrete patient, find the best solution. This was my first time on the Upgrade Congress. I was this far on the dental world. And I know this is younger brother of the dental world, right? But this is already not a baby congress. This is really very nice. People are really very friendly. Halls are full. And there is quite a lot of interaction between the lecturer and the audience, which I really like very much. So all positive recommendations from my side. Yes, I'm really, when I saw the lecturers, the titles, the presentations that I have seen, this is really on a high level that you can see, that you can comment, that you can see scientific things, you can see practical things, you can see real life cases, right? So there is something for everyone, I would say. Yes. I would like to invite you to join Dental World 2025, which is one of the biggest and most wanted and most visited regional congresses here in Eastern Europe. This would be an extraordinary place to see someone, to meet other people, to learn something new, and to enjoy this lovely town of Budapest in Hungary. See you.